My mom passed January 17th of this year. Dr. Malone with GI diagnosed her October 5th, and she presented with symptoms only 6 weeks before that. She was a nurse, so I think she knew something was wrong, but I don't think in her wildest dreams she thought cancer for sure. 6 weeks of this is kind of uncomfortable, this doesn't seem right, until it was unbearable at the 6 weeks, and Dr. Malone thankfully worked her in, had a colonoscopy, and found it. There was, blood in your stool, and then she did have some pain. But to be honest, any woman who has had kids, even Dr. Malone initially thought, maybe external hemorrhoids, maybe some internal hemorrhoids. And any woman who's had kids, that's something that you deal with. And as you get older, you don't know if the Mexican you had last night is going to change your bowel habits. She'd never been screened. Unfortunately, one of the struggles of being a nurse, I'd imagine, in what I've met and in my mom, is that they know what treatment's like. They know what, that having to be the patient looks like. And they kind of felt like, for my mom, I know she knew what signs to look for. Unfortunately, colorectal cancer is not one of those that comes with signs until it's too late. Nurses make the worst patients, and she was a horrible patient about getting to the doctor and doing things, and I think part of her may have been scared, but the reality is that fear of having that screening at 50 and then a re-screening at 55 because she has a family history of the polyps could have saved her life. It would have been one screening, they'd gone in, taken care of the polyps, and those polyps never would have had a chance to become cancer. It's hard to talk about my mom. It's hard to talk about her dying. But the reality is, one screening is all it takes. That's it. One screening to find out if you've got polyps, if you're gonna be predisposed. There's genetics. Colorectal cancer can be diet related. But they say it takes 5 years for those polyps to become cancerous. You have a window of opportunity. 5 years versus 3.5 months. 4 months before my mom died, she was working 16 hours a day here at the hospital. And she got sick and spent the last month and a half in a hospital bed. And it happened that fast with colorectal cancer, and that's what's hard. One screening versus 4 months of fighting for your life. Anyone should trade that any day.